I'm Dr. Ray Woods, and this is Behind the Hairline. I am the inventor of FUE and BHT and microsurgical scar repair, but today I'd like to mention and talk about BHT, body hair transplantation. In the 1990s, or 80s and 90s, I just saw so many people who were coming to me with absolutely ravaged hairlines. The back of their heads were just full of scars, unsightly, but also nothing you could use. There was just so little hair left. We couldn't use it to give a hairline or repair an area or give more density. It was unusable. And often the scars themselves could not be hidden. And this was tragic, and I remember distinctly a patient coming in and having the most horrendous damage to the back of his head, and still terrible, unsightly scarring and plugginess to the front and huge gaps. And I said, I can't do anything about this. You don't have enough donor left. This was 1998. The patient was devastated by this, but it was a hot day and he was wearing a Hawaiian shirt, and I noticed that he was like Magnum PI, just this hairy chest was just bulging out. And as he walked away, I thought, well, why not? Why not use body hair? I'll help repair the scar, make it less obvious, and I'll go in between the gaps. I mean, it cannot be any worse. It could only be an improvement. It was never ever done before. A hair transplantation used to treat unsightly scarring and an anesthetic hair transplant result. So that's how that started. And later on, it was featured on Ripley's Believe It or Not in 2000, I think, or 2001. A long time ago. The rest is history. So body hair is a brilliant resource, but what you see is what you get. It is true that if you've got good, strong, healthy, robust body hair, transplanted to the scalp, it'll take on some characteristics of natural scalp hair, but it will also grow longer, but it is logarithmic, meaning if you have very long, strong body hair, it will increase in length on the head in many cases. Not every case, but in most cases I've done, that's what actually happens. It increases in length to an extent, not full length like normal scalp hair. That doesn't happen, although I must say there have been a few cases which shocked me that the body hair just grew so long. But you can't promise that or guarantee it. If it grows the same length as it did on the chest or abdomen, that is a good thing. If the hair on the chest and abdomen is weaker, smaller and finer, it will also increase, but not as much. So when people come to me and they have very weak body and abdominal hair and they want density, I make it quite clear. You will get some coverage, but it may be thin. It'd be a little bit like bum fluff. You have to be very careful. It has its purpose. It can soften the hairline. It can fill in some gaps, but high density is not going to happen when you use body hair such as that. Then of course there's neck hair, beard hair, which must be taken only below the jawline, because the skin on the face is thinner, and taking hair from that region can cause more scarring. From the neck, the skin is very thick and elastic. So taking grafts from this area below the jawline means the holes that are left shrink in on themselves much more, and the healing is far greater. White dots are obvious. Well, they are not that obvious. They are there, but under the jawline, and if you have a very elastic neck tissue and some wrinkles, it blends in most cases. Can still be seen if somebody really knows what they're looking for. Sometimes it's a little bit more obvious, but patients understand this. And when it comes down to it, you want hair, you'd rather have it on your head and scarred areas, or repair donor scars with neck hair. And I've never seen anyone where it's been an issue. In many cases, you can't see it at all. So body hair and neck hair has become a huge boon for people out there who really beforehand had no hope, no chance, because their donor was completely decimated. That was 1998. So It was, again, treated as though it was some kind of joke and it couldn't happen, but of course it did, and the rest is history of that. So we'll be talking more about body hair down the track, and I'm Dr. Woods, and this is Behind the Hairline.